Hi everyone, it's Dr. Ramani. Welcome back to this YouTube channel on narcissism, narcissistic relationships, antagonism, healing from these relationships. And today we're going to take on a question we come up with over and over again, or come up against over and over again, which is trauma bonding. And we're going to talk about some of the differences and similarities of trauma bonding that comes out of childhood versus that which grows in adulthood. Obviously, we've talked a lot about trauma bonding on this channel. Trauma bonding is that connection, attachment, if you will, the bond formed through the alternation between good and bad, the conflation of love and chaos, the approach and avoidance, and then the cycle of making rationalizations and justifications and allowances, and the sense of fear at disengaging or setting boundaries, and the sense of shame around staying in it. It's about having the same fights over and over again that never get resolved. It's like this sort of familiar toxic cycles playing over and over again. Now, trauma bonding can originate from two different types of relationships. Those that start just in adulthood, and those that start in childhood. The childhood cycles of trauma bonding are much more sticky and often do go on to shape adult relationships that we get into. But the misconception is that you had to have had the trauma bonding cycle happen in childhood for it to then repeat in adulthood. Not necessarily. You can be from a happy, healthy, safe, and securely attached family of origin and still create a trauma-bonded relationship in adulthood. So let's break some of this down. In childhood, we know the drill. The trauma bonding comes out of the usual suspects. It could be because someone had inconsistent parents, narcissistic parents, unavailable parents, substance using parents, traumatizing parents, abusive parents, or some combination of the above. And as a child, no child is ever going to view the parent as perpetrator. It's too dangerous and would be a blockade to the essential attachment a child needs desperately met, right? So the child does a reversal and takes responsibility, or somehow doesn't register what's happening as abusive or harmful. They rationalize it, and the child will blame themselves for those bad days. They will cherish the good days and may even construct a grandiose and fantastical version of the idealized parent, and then simultaneously will be fostering a narrative of self that is sometimes good, sometimes bad. Trauma-bonded children are forever on a chase and creation of justified narratives around the parent, and the children are riddled with self-blame and shame. These are children who are often prone to anxiety and obviously to persisting in these cycles. The trauma-bonded cycle makes sense in a way. It keeps the child strangely safe, not having to conceptualize their caregiver as dangerous or bad, but rather as good. And if the child is bad, well, then that would mean that the child could get it together and be better. That's what they tell themselves. In trauma-bonded relationships, the child is not allowed to be themselves. The parent often resents the child for having needs or a sense of self or even an existence outside of the parent. The child is in essence a source of supply or even an extension of the parent, and that's it. If the child needs something more or different, they are viewed as a nuisance or a problem. So the child is forever negating their true selves to be and shape themselves into what the parent needs to ensure those attachment needs are met. These trauma-bonded relationships in childhood set people up with insecure, anxious, and perhaps even avoidant attachment styles going into adulthood. Now, trauma-bonded cycles in childhood can, not always, but can and often do replicate in adulthood. And some folks will say, I came out of that as a kid, and when I met someone healthy as an adult, I kind of felt flat and blah, and it didn't feel like love. But when I met that person who was invalidating, and there were the highs and the lows, I was always on my back foot and always wondering who I would get. Well, that felt like love. And that's an unfortunate legacy of these patterns. Now, having experienced trauma-bonded cycles in childhood don't doom you, okay? All is not lost. Therapy, especially trauma-informed therapy that allows you to unpack these cycles and understand them from an attachment perspective, lift the self-blame and shame, and permit you to start viewing yourself separately from this relationship, as well as educate yourself on these cycles, all make a big difference. However, you can have your first trauma-bonded cycles begin in adulthood, even if nothing happens in childhood, right? It can start in adulthood. Now, most often this will happen in the context of an intimate relationship, but it could also be a friendship or even a workplace relationship. You may even have a fully secure attachment, and then in adulthood, you may meet someone who actually does all the cycles, dynamics, and dance of a narcissistic relationship, the manipulation, the invalidation, the dismissiveness, the gaslighting, you know the drill. But all of this, as you know, all that bad stuff's happening, and their entitlement and their lack of empathy and their arrogance and their all of that's happening against that back and forth between good days and happy days and fun and love, and then boom, bad days. And then when that happens, it's the, well, it was great over the weekend, or gosh, when we first met, it was wonderful, and I'm so into them, and I'm sure we can make it better, and maybe I'm the one who's not trying hard enough, and relationships are hard, and I need to take responsibility for my part. When it happens for the first time in adulthood, we get these sort of higher order takes on it. It's less of the I am bad, they're good, I need to survive, but rather, I can see the cool stuff about this person and I want this to work, and it's hard to meet new people, or I love this job, or I want to be a good friend. Again, it's not that primal stuff. And as we have discussed, that happy family of origin story of yours can mean that you believe, oh, listen, if I'm just really nice and helpful and let them know I love them and that I care and I'll work harder, then all of this is going to be fine. It's not the childhood idea of relationships are chaos and chaos is love, but rather that relationships are good, and so let's do this and just be good. Adult trauma-bonded relationships will often have more of a rescuing, problem-solving vibe to them. And while adult trauma-bonded relationships are less primitive and almost more cognitive, they can still, as many of you know, really do a number on you. A person who endures an abusive boss, it's the first time it's happening for you in adulthood, may believe that, I just need to show up and do a great job because I want to stay at this great company. Or it could be a person who has a toxic friend that they meet in adulthood and they stick it out and they're like, we went to college together and we do all this stuff together and we take trips together. They're my partner in crime, right? And in the romantic relationships where we see this sort of adult trauma-bonded cycle start most commonly, again, the narcissistic relationships often have a lot of good stuff and more than enough to keep you enthralled and excited. Your narcissistic partner may tick lots of boxes. And since it does take a year or two to really see these relationships clearly, you may already have a lot of sunk cost. You may live together, be engaged, or even be married or have kids. When it comes to healing, even if a relationship starts in adulthood, your first time at the trauma-bonded dance is adulthood, it's still really challenging. However, adult trauma-bonded relationships, from a treatment perspective, can often heal quite a bit through psychoeducation. People are taught the patterns, taught about radical acceptance, you recognize it's not going to change. There may be some initial resistance to this in an adult trauma-bonded relationship, but it's not that primal, held in your body attachment to the push and pull of the trauma-bonded relationship. Some people will say, well, maybe I'm not trauma-bonded because this didn't happen to me in childhood. No, sadly, it can happen at any age. The ramifications may be different, but the sense of stuckness, confusion, despair, self-blame, anxiety, and helplessness are pretty similar regardless of when these trauma-bonded relationships originate. So it is important to recognize these two sort of paths of origin can result in different experience. Are there people out there who have the childhood experience and then in adulthood manage to get into a healthier relationship? It is, but if that doesn't get worked on, those adult invalidating relationships, and the person gets lucky and meets someone nice in adulthood, it still has to get addressed because our intimate partners, not our own relationship. It could show up in a friendship or a workplace thing. So that childhood stuff does need to get worked through. And then for most people, the classical cycles, it happens in childhood and it happens in adulthood. But for those of you that your first time at this rodeo was in adulthood, it's still trauma bonding. It just might be a slightly different pattern of healing. Thanks again.